Personal Care Activities Through the Ages by Joshua Witt, Kara Van Zant, and Madison Powers. Deodorant is a hygienic product that is not usually used until later school age years or adolescence. Children who are very active may begin using deodorant before those who are not quite as active. Adolescents have more developed sebaceous and apricot glands that produce more oil on the skin. These oils can cause body odor. Children who have body odor and are not using deodorant can be bullied for smelling bad. Parents need to be sure that their child understands proper use of deodorant and how it can be important for their social life, not just their hygiene. Shaving is not usually a concern until a child reaches adolescence. Puberty causes new hair growth on the body. Parents should let their children know that they can come to them with any questions that they have about hair removal. Children will often experiment with shaving before asking questions and can seriously injure themselves. Girls will typically ask questions before boys. Oftentimes boys see facial and body hair as a badge of honor and a sign of them growing up, and sometimes they don't want to remove that hair. Girls need to be informed of the effects of alternative methods of hair removal that can cause damage, such as chemical hair removers and wax. They can easily get chemical burns or thermal burns from these. For infants, a very soft bristled brush is recommended for combing or brushing their hair. For toddlers and preschool-age children, special consideration needs to be taken into account because they can be very impatient and uncooperative. Parents want to make sure that these activities are kept as stress-free as possible and that they keep their patience. By school age, children should be able to brush their hair on their own and be in somewhat of a habit of doing so once or twice a day. School-aged and adolescents need to brush their hair at least once a day, and they should be able to do so independently. Adolescents usually will be in a good routine of brushing their hair. Special consideration needs to be taken into account with African American children or other children with ethnic hair types. Some children will have their hair styled in a way that they will not need to have it brushed for several days. Adolescents are very prone to acne. Parents need to understand this and that this can be a stressor for their children. All ages need to be sure to have sunscreen when sun exposure is a possibility. Preteens and teens need to be reminded that they are not invincible and that they need sunscreen. It can be very difficult to get sunscreen on a toddler or preschool child. Parents must be diligent in keeping the child's skin protected. Skincare begins in infancy, and infants have very sensitive skin and require special soaps and special detergents for their clothes and bedding. Special consideration is taken into account for diaper rash and skin breakdown due to urine and feces, and infants need to be kept as clean as possible. For bathing, newborns will only have sponge baths until their cord stump falls off and their sight is healed. After that, they can begin baths in a small bath made for infants. Parents need to be educated and use special soap made for infants and young children. They also need to be aware that infants only need to be bathed about 3 or 4 times a week. If it's much more than this, their skin can dry out, and their hair only needs to be washed about 1 to 2 times a week. Toddlers and preschool-age children engage in playtime during their bath. This can help make this a fun activity that they look forward to. A relaxing bath can promote sleep with infants, toddlers, and preschool-age children. They need to be constantly supervised until around 7 or 8 years old. It only takes 1 to 2 inches of water for a child to drown, so parents need to be diligent with supervision. Adolescents may need to shower once or more a day depending on their activity. By the time a child reaches this stage, they should be getting at least 1 bath or shower a day. They also need to be taught the importance of good hygiene and keeping up with this practice. Posturing is an important consideration for all ages. Car seat posture is important for infants and toddlers. Such as the infant in this photo, this represents poor car seat posture. Parents need to keep an eye on their child's posture habits. Posture during playtime is important to consider with preschoolers. how they lift things, how they turn, how they do their activities. For school-age children and adolescents, posture during the school time and study time plays a huge part in their development. It is important to encourage good posture habits as early as possible for all children. When trimming nails of an infant, one must be sure to not trim too closely, but to trim enough to where the child cannot easily scratch themselves. It may be difficult to trim a toddler's nails, but it is needed. Again, we want to make this as stress-free as possible. Preschoolers get regular nail trims, and by adolescence, they should be able to do this pretty much on their own. Parents need to be made aware of proper nail trimming techniques so that they can educate their children, or so the nurse can educate their child as well. A child will often get their first haircut around 1 to 2 years of age, and the haircut is completely at the discretion of the parents. If they would rather their child have longer hair, they can wait a little bit longer to get their hair cut. Typically, around school age to adolescence, the children can voice their opinions on what they want their hair to be, and parents and the child can discuss this and make a decision based off of that. Feminine care begins at infancy. For example, when a parent is changing the diaper of a female infant, they need to be sure to wipe from front to back to prevent infection. They also need to be sure to clean around the labia to also prevent infection. Young female children need to be taught to wipe from front to back to prevent infection and for proper cleaning technique. They also need to be sure to teach their child about the importance of daily cleaning and cleansing. For children who are going through puberty and beginning their menstrual cycle, the parent needs to educate them and answer any questions that they have, or ask the nurse any questions they may have that they don't know the proper answer to. They also need to make going into puberty as much of a positive transition as possible. Dental care for infants begins with teething and the eruption of primary teeth. When the primary teeth begin to erupt, parents need to use a damp cloth to wipe the baby's mouth with. They can use a very soft bristled toothbrush when more teeth emerge. Typically, an infant is recommended to have their first dental exam around 6 months old. Toddlers and preschoolers will need help properly brushing their teeth. The primary teeth have usually all come in by the preschool years. School-age children lose their primary teeth and have new permanent teeth erupt. Dental hygiene is critical for preschoolers and older. The end. Thank you for watching.